Today we are going to learn about electroconvulsive therapy. Yes, myself Anjal, working as assistant professor, mental health department, ES College of Nursing. Now we are going to see about the objectives of electroconvulsive therapy, introduction, history of electroconvulsive therapy, description of electroconvulsive therapy, definition of electroconvulsive therapy, what are the types of electroconvulsive therapy, parameters of electroconvulsive therapy, application of electroconvulsive therapy, frequency and courses of electroconvulsive therapy, what are the indication and contraindication of electroconvulsive therapy, what are the roles and responsibility of nursing in electroconvulsive therapy procedure, and complication of electroconvulsive therapy. First, what is the electroconvulsive therapy? Electroconvulsive therapy is the medical procedure. It is the highly effective treatment for certain severe mental health conditions. Electroconvulsive therapy, it is a type of somatic treatment in which electrical current is applied to the brain of the patient. The passage of an electrical stimulus of 70 to 120 volts produces a grand mal seizure. Electroconvulsive therapy, it is a type of somatic and physical treatment which is we are passing the electrical current with the use of electrodes. We will creating the electrical stimulus and it will produce the seizure. Next, move on to history of electroconvulsive therapy. There are two appearance and there are two models of electroconvulsive therapy history. The first appearance of model, it is discovered by a scientist Nadu in the 1935. And second appearance model is discovered Sterility and Benny introduced the second model of electroconvulsive therapy. It is the electric shock induces seizure, and it is the nowadays we are using this method. This method introduced in the year of 1938. Next, we are going to see about the description of electroconvulsive therapy. Most of the people are knowing the electroconvulsive therapy. It is the painful procedure, but it is not a painful procedure. It is a painless from a electrical therapy. And also it is used for patient with depression and schizophrenic disorder. It is prepared by barbiturate, anesthesia and an injection of chemical relaxant. An electrical shock applied for the fraction of the second through electrodes applied on the temporal region. And next, we are move on to definition of electroconvulsive therapy. Electroconvulsive therapy, it is the artificially induction of grand mal seizure. And through the application of electrical current to the brain, the stimulus is applied through electrodes which are placed either bilateral frontal temporal region or unilaterally on the non-dominant side. We are induced the artificially induction of grand mal seizure to the patient. It is applying through the application of electrical current. How it is induced the electrical current and passing the electrical current means we are applying to the electrodes on the head of the patient and it is placed either bilateral and frontotemporal region unilaterally non-dominant side. Mostly we are applying and place the electrical load mostly right hand side. Next, types of seizure. The types of seizure is one is clonic phase, another one is tonic phase. The tonic phases, the seizure are producing and during the seizure limitation is 10 to 15 seconds and the clonic phase is lasting the duration of 30 to 60 seconds. In clonic phases, the body totally rigid movement and also clonic phases, the patient body totally uncontrolled flexion of the body and also this is the difference between clonic and tonic phase. Mechanism of action. There are exact mechanism is unknown, but to produce the biochemical changes in the brain, in increase in the level of norepinephrine and serotonin similar. And 2. Effect of antidepressant medication. And types of electroconvulsive therapy. One is direct ECT, another one is modified ECT. In direct ECT, it is given the absence of anesthesia and muscle relaxing. In this method, we are not using nowadays because in this method, we are not administering the anesthesia and muscle relaxant. It will creating the cognitive impairment, and also the patient will getting the more side effect of electroconvulsive therapy. And modified ECT, in the modified ECT we are administering a muscle relaxant and also the general anesthesia also. It will reduced and less complication of electroconvulsive therapy. Nowadays we are using this method, modified electroconvulsive therapy. Next, parameters of electrical current applied. We are maintaining the standard dose according to the American Psychiatric Association given this standard in the year of 1978. The voltages, the standard voltages we are giving 70 to 120 voltage, and duration we are maintaining 0.7 to 1.5 seconds. Next, application of electrodes. How it is applied means bilateral electrical convulsive therapy and unilateral electrical convulsive therapy. The bilaterally we are placed the electrodes bilateral frontotemporal region, and unilaterally we are placing the electrodes non-dominant side. Mostly we are applying the or placing the electrodes one side of the electrodes. It is called as unilateral. Next, move on to the application of electrodes placed and also the measurement of electrodes. First, we are measuring above the midpoint of the frontotemporal region. We are place the electrodes lateral canthus of the eye to and tragus of the ear. Lateral side we are lateral canthus of the edge of the canthus of the eye to tragus of the ear. We above the 2.5 centimeter to 4 centimeter we are placing the electrodes. We are placing both the side, it is called as bilateral same measurement, and unilaterally one side of non-dominant side we place the electrode measurement above the midpoint of the line joining of the lateral canthus of the eye to tragus of the ear. We are placing the electrodes. It is called as unilateral side. And frequency and number of electroconvulsive therapy needed. Frequencies, there are 3 times per day we are administering the electroconvulsive therapy if the psychiatrist advised, and also the indication of the patient. And causes of electroconvulsive therapy. Treatment of depression usually consists 6 to 20 times, psychosis and mania more than 20 times, and catatonic 3 to 5 times. These are all the frequency and causes of electroconvulsive therapy. Next, indication of electroconvulsive therapy. The first major indication is severe depression. In this severe depression, patient with along with having the suicidal risk and antidepressive drug, it is not satisfactory, and also it will creating the more side effect of patient. Now that time we are stop and start the electroconvulsive therapy. Mania, third one is severe catatonic, and fourth one is severe psychosis like schizophrenia or mania condition. We are indication of electrical current electroconvulsive therapy. Organic mental disorder, and also the indication of other indication of electroconvulsive therapy. For the pregnant woman in whom antidepressant place the fetus at risk for congenital defect, it may have a safer profile than antidepressant or psychotic drugs. In elderly or breastfeeding patient receiving the electroconvulsive therapy, it also recommended for patients who have exhibited the response the electroconvulsive therapy previously. Next, contraindication of electroconvulsive therapy. First one is absolute, second one is relative. Before going to electroconvulsive therapy, giving the electroconvulsive therapy, we should assess the patient intracranial pressure. If the patient having the increased intracranial pressure means we should not give the electroconvulsive therapy. And also relative means if patient having a cardiovascular, cerebrovascular effects, severe pulmonary disease, brain tumor, acute myocardial infarction, congestive heart failure, retinal detachment, high risk of pregnancy, we should not give the electroconvulsive therapy. Next, role of nurse in electroconvulsive therapy. The first role is pre-ECT room, second one is ECT room and recovery room. In pre-ECT room, we should advise and we should assess the patient condition. We should assess the patient vital signs and patient if having getting a anxiety and also the fear. Now we are advised to relieve the pain and relieve the fear and anxiety level and assess the vital signs level, and also we will get the informed consent to the patient as well as the family members. We should explaining the procedure, detailing indication, side effect and complication of the electroconvulsive therapy, and we should advise to take bath, hair wash, because it will creating a injury of the patient, because we are producing the electrical current, so it will attracting the electrical current. So we should advise to take bath before going to ECT, and also we should maintaining the nil per water before the 6 hours. Next, also we should advise to take relaxation of the patient. Next, we should check the records of the patient pre-ECT procedures. Next, ECT room, we will arrange the equipments and also the emergency drugs. And maintaining the position, we are maintaining the supine position only. Next, also we are side-laid position also we are maintaining after the ECT, because it will collect the collection of the secretion of the patient. Next, and also the placing the position and also inside the IV line and placing the electrodes, and we should removing and checking the if patient wearing any jewelry, ornaments and metals. So if patient does not having anyone means we should apply and we should give the electrical current to the patient, and we should monitoring the which type of seizure will occurring. The nurse should notice the seizure type and also recording the vital signs also. Next, we will transmitting the recovery room. In the recovery room, the nurse should follow the patient vital signs level and conscious level, and to advising the take more amount of water or plenty of water after the 6 hours, to take advice to take bath, to why means it will reduce the confusion level, to monitoring the if patient having the cognitive impairment or confusion, so we should advise to take bath also, and recording and monitoring the patient, and as well as and also to recording and documenting the in our documents. Next, complication of electroconvulsive therapy. First, the patient will getting the memory impairment, drowsiness, restlessness and confusion, poor concentration, anxiety. Patient will have a headache, weakness, fatigue, backache, muscle aches, dryness of mouth, palpitation, nausea, vomiting, tongue bite also. So we should providing the mouth gag, preventing the tongue bite. These are the complication. I know you are all very well know about this topic. Please subscribe and share this video. Thank you.